Hello, and welcome to another episode of Med Madness. Today we're delving into an essential and often misunderstood topic, physician misconduct and medical malpractice. This subject is crucial for medical students and practitioners alike, as it underscores the importance of adhering to medical standards and understanding the legal implications of medical practice. In this episode, we will explore the key elements of medical malpractice, discuss several real-world scenarios, and highlight the importance of maintaining high standards of care. By the end of this podcast, you'll have a clear understanding of what constitutes medical malpractice and how to avoid it in your practice. Now let's break down the key elements of medical malpractice. Next, let's discuss what constitutes medical malpractice. Medical malpractice occurs when a physician fails to follow the accepted standard of care, resulting in patient harm. Let's break down the essential components. First, the physician must have a duty to care for the patient, established through a patient-physician relationship. Second, the physician's actions must deviate from the accepted standards of care. This means not following the protocols or guidelines that are typically expected in similar situations. Third, the deviation must directly cause harm to the patient. This harm can be physical injury, emotional suffering, or financial loss. Finally, the patient must suffer actual damages such as injury, emotional distress, or death. Now, let's move on to real-world scenarios. Consider a scenario where a physician performs a paracentesis and accidentally penetrates the bowel wall. This complication, although rare, occurring in about 0.5% of procedures, can lead to significant patient harm. To determine malpractice, it must be shown that the physician's technique deviated from the standard of care, such as not using ultrasound guidance. Next, imagine a patient who experiences a cardiac arrhythmia after being prescribed ondansetron for nausea. If the patient had no known risk factors and the prescription adhered to current screening practices, this would not constitute malpractice. Physicians are not required to screen all patients with ECGs before prescribing ondansetron unless there are specific risk factors present. Next, let's discuss some common malpractice considerations. Lost income and non-monetary damages can be factored into malpractice claims, but are not necessary to establish liability. Discrimination based on social characteristics can constitute malpractice if it deviates from standard care. A high rate of errors may suggest negligence but does not alone establish liability. Adverse events, even rare ones, must be managed according to current standards of care to avoid malpractice. Now let's look at a real-life case study. Dr. Smith, an emergency physician, treated a patient with severe abdominal pain. During the evaluation, Dr. Smith performed a paracentesis to relieve ascites. Unfortunately, the patient developed peritonitis due to bowel perforation. Despite this being a known complication, the investigation revealed that Dr. Smith did not use ultrasound guidance, which is the standard of care in such procedures. As a result, Dr. Smith was found liable for medical malpractice due to this deviation. In conclusion, understanding medical malpractice is vital for every medical professional. Always ensure that you are adhering to the accepted standards of care to avoid legal repercussions and provide the best care for your patients. I encourage you to engage with the pre- and post-podcast quizzes and Anki flashcards available for this topic. They are excellent tools to reinforce your learning and help you master the complexities of medical ethics and malpractice. Thank you for tuning in to Med Madness. Until next time, stay diligent, stay informed, and keep striving for excellence in your medical practice. For more lifelike voices, higher character limits, and dubbing content in other languages, head to https://11labs.io !UTM_source =11labs_GPT.